Hello, this is Matthew Bell from Alzheimer'sProof.com. My dad, Jim, had Alzheimer's disease for 10 years. I cared for him for 4 years in his own home, and then he was in a nursing home for 4 years after that. The cost of the nursing home wiped out what was left of my dad's retirement savings and left my mom in a horrible situation. And all of this because Jim had no plan. To be clear, long-term care poses a significant risk to your retirement plan. It can literally devastate your assets. Additionally, nationwide, Alzheimer's is the 6th leading cause of death in the United States. As a caveat, I should say that I am not a lawyer, I'm not a doctor, I cannot give you legal advice or medical advice, and I can't give you specific financial advice. What I'm about to discuss is for informational purposes only, and I invite you to check out written material at my website, Alzheimer'sProof.com, if you would like to explore any of these issues further. What is long-term care? Let me back into that by saying long-term care has 2 triggers. A person may need long-term care if he or she lacks 2 out of 6 activities of daily living. The activities of daily living include things like being able to bathe yourself, being able to dress yourself, being able to feed yourself, being able to transfer in and out of bed by yourself, being able to control your bodily functions. If you lack 2 out of 6 of those activities of daily living, then you would qualify for long-term care. A second trigger would be cognitive or mental. If a person's cognitive capacity declines to the point where he or she needs constant supervision, then you would need long-term care. Long-term care is also called custodial care. Long-term care would be the help that you would receive to complete or perform the activities of daily living or to be supervised if you were a danger to yourself or to others. This raises the question, is long-term care covered by your health insurance or by Medicare? And the answer is no. Long-term care or custodial care is not covered by health insurance or by Medicare. Think of it this way. Health insurance is designed to give you skilled medical care. That could be doctors, it could be skilled nursing, it could be care in a hospital setting. The key point is this kind of care, skilled care, requires training and education to a high extent. Physicians spend years studying to be able to interpret test results, prescribe medications, diagnose conditions. Nurses are highly trained to be able to dress and clean wounds, to be able to administer shots, to be able to draw blood. It would be overkill, so to speak, to have somebody with that degree of education wiping a person's butt or helping them to get in and out of bed. But these are the sorts of things that are required when a person needs long-term or custodial care. But what is the risk? There are really 2 sets of risk. The first is applying to the person who is declining, physically or mentally, and the second applies to the caretaker. In both categories, there are physical and emotional risks as well as financial. Physically, of course, Alzheimer's ravages the brain and causes degeneration that ultimately leads in the death of the whole body. For caretakers, there's a physical toll as well. Caring full-time or part-time for a person with Alzheimer's can shorten the lifespan of the caretaker. The person's life expectancy may go down just in virtue of the severe stress and strain that he or she is under. By no means is the financial risk more important than the physical or the emotional risks, but financial risk is a little bit easier to quantify. Each of the risks needs to be assessed in talking about care for Alzheimer's disease. According to a government study, about 60% of people over the age of 65 will need some kind of long-term care in their life. This study was criticized on several grounds, one of which was that the definition of long-term care was so expansive that it included things like remedial care and things like this that aren't normally covered under a definition of long-term care. Rehabilitation and such like is not normally considered long-term care. But even less than 60%, other studies have indicated that the risk might be 50%, might be 30%. It's a significant risk. Easier to quantify are the numbers for people once they require long-term care, how long do they need it? And this helps us to get a fix on the actual financial risk. So current numbers suggest the following. The average stay in a nursing home for a person in the United States is about 2.3 years. Men, if they have to go into a nursing home, are typically there for about 1 to 3 years. Women, if they have to go into a nursing home, are typically there from 2 to 5 years. The national average is about $80,000 to $90,000 a year for care. In my area, the cost ranges from about $75,000 a year to about $150,000 a year. Much depends on where you're at, what other amenities are available, whether there's memory care that's required, and things like this. But the median would be about $100,000 in my area, which is near the national average. Since it's an easy figure to work with, let's stick with $100,000 per year. So think through the numbers. At $100,000 per year, if the average person has to stay for 2.3 years, that's $230,000. For a man in a nursing home, it could be anywhere from $100,000 to $300,000 total. And for a female in a nursing home, it could be anywhere from $200,000 to $500,000 total for a stay in a nursing home. Since neither health insurance nor Medicare cover long-term care, as we saw, there are really only 3 ways to pay for long-term care. One way is to private pay. You have a certain amount of assets, you have a certain income stream, maybe a pension, maybe Social Security, and you simply have to use those assets or that income stream to pay for your long-term care yourself. For people who get to a point in paying for care themselves where they run out of money, the other option would be Medicaid. Medicaid is a government-sponsored program, not to be confused with Medicare. Medicare is basically health insurance for seniors, retirees. Medicaid is aid or assistance, monetary assistance for people who fall below a certain threshold, almost like a poverty level threshold. The final way to pay for long-term care would be using proceeds from a long-term care insurance policy. Each of these options has its pluses and its minuses. Thinking through them in reverse, one benefit of a long-term care insurance policy is that the proceeds, when they pay out, can protect the family against having to spend down their own assets. One risk is that you will pay into the policy and never use it. But when you think of the statistical chance that you may need long-term care, it is more pronounced than in many estimates for whether or not your house will burn down or whether you would crash your car and need your full insurance on your vehicle. The point is that we pay for risks all the time that are less significant than the risk of long-term care. The other options of private paying can be an option for certain people. If you have assets in the vicinity of $500,000 to a couple of million, could you pay for long-term care for you and your spouse? You probably could. Could you pay to rebuild your house if it burned down? You probably could. Do you want to have to pay for those things? I would expect not. Not just for the usual reasons, but the question would be, if you have to use part or all of your retirement savings or other assets to pay for long-term care for one or both persons, that might deplete, and certainly will deplete, the amount of money that's available for the other person to retire or for legacy planning for purposes of giving something to kids or grandkids. The least desirous option probably would have to be Medicaid. Medicaid, you are severely limited in terms of the amount of assets that you can have. You have to spend down your assets almost completely out in order to qualify for it. Spouses sometimes also have to spend their assets down, perhaps not all the way down. They're usually allowed to keep one house, a car, and something in the retirement, but it's very minimal, maybe $30,000. You have to consult, I should say, with an expert in your area, somebody who knows Medicaid, a lawyer or other expert. I am no expert. I can't give you legal or financial advice regarding Medicaid application. But I can say that if a person has to qualify for Medicaid, it means that they are otherwise impoverished, number one. And number two, it limits you in terms of where you can acquire your care. You have to seek a nursing care facility that has an available Medicaid bed. And in many cases, men and women would be separated. So men usually would share a room with another man, woman with another woman, so that if a husband and wife, maybe married for many years, had to both receive nursing care, they would likely be separated. There's no ideal solution, and I don't have a crystal ball. The best that you can do is try and make a good decision with the facts that are available. Many people will say that there's another option, namely that your family can take care of you, sons or daughters or grandchildren. If this is your plan, it can work. You should be mindful of the fact that this is a heavy burden to place on to family. The key question would be, have you had that conversation? Don't expect that sons and daughters or other family members will be available in your time of need. Have a conversation about it and try to make sure that it's the right move for your family. Again, being a caretaker for a person with dementia or Alzheimer's disease can put a significant strain on family. I had 2 young children when my dad needed care. He became aggressive and the whole home environment was changed significantly due to that. It was a bad situation. Many fathers would not relish the idea of having to have their daughters or sons wipe their butts, or frankly, even having to move somebody out of bed can be a significant strain, and again can negatively affect the caretaker. I'm not telling you that it's not a viable option, but I would say try to explore the other options that are available to you. My purpose in this video is simply to help you to think through some of the issues, maybe sketch the lay of the land a little bit, and get the conversation started. Thank you for joining me today. Please check out my website, alzheimersproof.com. Subscribe and like the video if you found something of use. Thank you so much.